Welcome to Health 360. Today, we're taking an in-depth look at pneumonia in adults, a condition that can be both common and dangerous. But with the right information, it's entirely manageable and often preventable. Pneumonia affects millions of adults every year and can lead to serious health issues if not properly understood and treated. In this video, we'll dive into what pneumonia really is, the different types, symptoms to watch out for, and some important prevention tips. So whether you or a loved one is affected, stay tuned to learn everything you need to know about pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs. These air sacs, called alveoli, may fill with fluid or pus, causing symptoms that can range from mild to life-threatening. Pneumonia can be caused by various organisms, including bacteria, viruses, and fungi, with the type of pathogen determining the specific type of pneumonia. Pneumonia is quite common globally and remains a significant health concern, particularly among vulnerable populations like the elderly, young children, and those with weakened immune systems. Here's a breakdown of how common it is. Global prevalence. Each year, around 450 million people worldwide develop pneumonia, which is about 7% of the global population. This makes it one of the most frequent infections affecting people of all ages. Mortality. Pneumonia accounts for over 4 million deaths annually, especially affecting older adults and individuals with chronic health conditions. It's one of the leading causes of death due to infection, especially in low and middle-income countries. In the United States, pneumonia is a frequent cause of hospitalization. Around 1 million people are hospitalized with pneumonia each year, and approximately 50,000 die from complications related to the infection. Among older adults, the risk of pneumonia increases with age, particularly for those over 65. Older adults are more prone to severe pneumonia and complication due to weaker immune systems, and often pre-existing conditions like COPD or heart disease. Young children. Pneumonia is also common among young children, especially in developing countries, where access to vaccines and health care may be limited. It's estimated that pneumonia causes around 15% of deaths in children under the age of 5 worldwide. COVID-19 impact. Since the COVID-19 pandemic, pneumonia awareness has increased, as COVID-19 often leads to viral pneumonia, and this has led to more hospitalizations and increased public focus on respiratory health and vaccination. Though common, pneumonia is often preventable and treatable, especially with proper vaccination, early detection, and prompt medical care. Types of pneumonia. Let's explore the different types of pneumonia in depth. Each type varies by cause, symptoms, and treatment methods, so understanding them individually can help in knowing what to look out for and how they're managed. Bacterial pneumonia. Bacterial pneumonia is among the most prevalent forms of pneumonia, often caused by the bacterium Streptococcus pneumoniae. Other bacteria, like Haemophilus influenzae or Staphylococcus aureus, can also lead to this type. This form of pneumonia often develops after a cold or flu, with bacteria taking advantage of a weakened immune system. Symptoms of bacterial pneumonia can be severe and include high fever, chills, a productive cough with yellow or green mucus, chest pain, and difficulty breathing. Bacterial pneumonia often requires antibiotics, and in more severe cases, hospitalization may be necessary to prevent complications. Viral pneumonia. Viral pneumonia is caused by viruses like the flu, respiratory syncytial virus, RSV, and recently the SARS-CoV-2 virus responsible for COVID-19. Viral pneumonia typically causes milder symptoms than bacterial pneumonia, but it can become more severe, especially in people with weakened immune systems or pre-existing health conditions. Symptoms of viral pneumonia are often similar to bacterial pneumonia, but may also include sore throat, headache, fatigue, and muscle pain. While antibiotics are ineffective against viruses, antiviral medications, rest, and supportive care such as hydration and oxygen therapy are commonly used in treatment. Recovery may take longer depending on the virus involved and the patient's overall health. Fungal pneumonia. Fungal pneumonia, although rare in healthy adults, can be dangerous, especially in those with compromised immune systems. Fungal pneumonia is often caused by fungi, such as histoplasma, coccidioides, and cryptococcus. It's commonly found in certain geographic areas, like the Ohio and Mississippi River valleys in the United States, or desert areas where coccidioides fungi thrive. Symptoms include fever, dry cough, and chest pain, which can resemble tuberculosis. Treatment for fungal pneumonia involves antifungal medications and can require a long course to fully eradicate the infection. Understanding the geographic risk factors and taking precautions when traveling to affected areas can help reduce the risk of contracting fungal pneumonia. Aspiration pneumonia. Aspiration pneumonia occurs when food, liquid, or vomit is inhaled into the lungs instead of being swallowed. This can happen in adults with swallowing issues, often linked to neurological disorders or conditions like stroke, dementia, or impaired consciousness. Aspiration pneumonia often involves bacteria from the mouth or stomach, leading to a bacterial infection. Symptoms of aspiration pneumonia can vary widely, but commonly include cough, chest pain, difficulty breathing, and fever. Treatment generally includes antibiotics and supportive care. Preventive measures, such as avoiding eating right before lying down and working with speech or occupational therapists, can be helpful in managing the risk of aspiration pneumonia. Community-acquired pneumonia, community-acquired pneumonia, or KP, is one of the most common types of pneumonia. It's contracted outside of hospitals or healthcare settings, often spreading from person to person through airborne particles when someone coughs or sneezes. This can be bacterial, viral, or even fungal. Symptoms are typically similar to other pneumonias, including high fever, chills, chest pain, and shortness of breath. Treatment depends on the causative agent and severity, but CAP can be managed effectively with proper care, including antibiotics or antivirals as needed. In addition to the main types, it's also important to be aware of hospital-acquired pneumonia, HAP, and ventilator-associated pneumonia, VAP. HAP occurs during a hospital stay, typically in patients with compromised immune systems, and VAP can develop in patients who require ventilator support. Both types are typically bacterial and tend to be more resistant to standard treatments, requiring specific, often stronger antibiotics. Proper hygiene practices and hospital protocols are critical to reducing these infections. Symptoms of pneumonia. Regardless of type, there are common symptoms of pneumonia that everyone should recognize. These include cough, which may produce green or yellow mucus, fever, often with chills, sharp or stabbing chest pain that worsens with breathing or coughing, shortness of breath, fatigue, and muscle pain. While these symptoms can overlap with other respiratory infection, their persistence and severity can be indicative of pneumonia. Risk factors. Certain individuals are at higher risk for developing pneumonia. This includes adults over the age of 65, smokers, people with chronic illnesses like diabetes or heart disease, individuals with compromised immune systems, such as those undergoing cancer treatments or with HIV/AIDS. Recognizing risk factors can help in taking preventive steps to minimize exposure and infection risks. Diagnosis and treatment options. Diagnosis often involves a combination of physical exams, chest X-rays, and blood tests to determine the infection type and severity. Depending on the cause, treatment options vary. Bacterial pneumonia, treated with antibiotics. Viral pneumonia, managed with antiviral medications and supportive care. Fungal pneumonia requires antifungal drugs. For severe cases, hospitalization may be necessary, especially in those with compromised health, to provide oxygen therapy or intravenous antibiotics. Prevention and vaccination prevention is a key aspect of reducing pneumonia risk. Vaccination is one of the most effective preventive measures, especially the pneumococcal vaccine, which targets Streptococcus pneumonia, and the flu vaccine, which helps prevent viral pneumonia complications. Other preventive steps include practicing good hand hygiene, avoiding smoking, keeping a healthy immune system through diet and exercise. When you should seek medical attention, pneumonia can escalate quickly, so seek medical attention if you or a loved one experiences severe symptoms like persistent high fever, confusion, especially in older adults, rapid or labored breathing, chest pain that worsens over time. Pneumonia is a serious condition, but with early detection, treatment, and preventive care, most adults recover fully. Remember, awareness and timely intervention are the best tools in managing pneumonia. If you found this information helpful, be sure to like, subscribe, and share this video to spread awareness.